We've had husbands that have come in with their wives and saying how excited they are about what has happened for their wife. Their intimacy and everything is so much better. Everything has just gotten better for them.
Hello, beautiful. Welcome to Aesthetic Influencers, where we explore the world of medical aesthetics and the relationship between inner and outer beauty. We're on a mission to empower 1 million women a day to level up their look and their life through the Bianca lifestyle of beauty, intelligent decision-making, attractiveness, and noble character attributes. I'm your host, Marco Emilio Valle, and you're gonna love today's show.
I had breast cancer 7 years ago. I was on medication that dried my skin out very much. And it takes the collagen out of your skin and makes everything so dry. I could not take any type of hormones due to the breast cancer, being positive hormones for that. And so Dr. Shepard said, let's try the Mona Lisa and see how it does for you. And it was wonderful. It worked. 2 to 3 sessions of it. I believe it was like 6 weeks apart. I had patients that I spoke to about it that came back raving about it, that brought their husbands in raving about it, said how much and happier their lives were because of the Mona Lisa. It helped the intimacy, which they were not able to have because of the dryness in the vaginal area. One of the patients said, my husband is so happy. He thinks you're his second angel. So, but it's a blessing to have it. There's so many women out there that need this procedure done to have them have a healthier life.
Sherry, you had experienced vaginal dryness specific to the therapy that you were getting to battle your breast cancer.
Yes.
Dr. Shepard, how common is this for just ordinary women?
Yeah, absolutely. When we think of vaginal dryness, that really can be something that women experience even as early as in their 40s. But what we are finding with the decrease in estrogen that happens in menopause, or in Sherry's particular case, and women who have breast cancer that maybe have some type of chemotherapy or surgical removal of their ovaries, they really have a sharp depletion in estrogen, which causes the vaginal tissue to dry. And the reason that is, it's not like it's kind of like turning a water faucet off, but it changes the tissue architecture. Estrogen has so many benefits, and it really replenishes tissue in a way that when you deplete it of estrogen, it really becomes more fragile, becomes more dry. It really doesn't have that distensibility or elasticity. And especially what Sherry was experiencing from her particular case was she said it felt like paper cuts. And that's because the skin was so fragile. And it doesn't really have the ability to restore and repair like it does when you do have estrogen. So with all of those changes, and specifically for breast cancer patients who do go through treatments that decrease that estrogen and impact the ovaries, a lot of women do suffer from having vaginal dryness, pain, irritation, and really things that are impacting their daily life.
And you would typically recommend hormonal therapy, estrogen, as Sherry was mentioning, but she could not get that because of her cancer treatment?
Yeah, that's a great question because hormones are actually a great way to restore hormones when they're depleted. But even women who don't have breast cancer and maybe never had some of the experiences that she had due to decrease in estrogen, estrogen is, or hormone replacement therapy rather, is one of the ways that you can do that. But there are so many other aspects and techniques and modalities that can really help with vaginal dryness. So I love having that conversation to show the breadth of what's available because many women do believe that hormone replacement therapy is the only way to really tackle that issue. But there's, again, so many different ways with radio frequency, CO2 laser with the Mona Lisa touch that we use here, and also with extraction of blood for PRP, which is plasma-rich platelets. And again, restoring the area by injecting that back into the vaginal area. There's so many modalities that we have now. So I think that women should be given the luxury of given choices. But for women who can't take hormones, CO2 laser, radio frequency, vaginal rejuvenation, as people like to call it. Specifically for me in my practice, I use the Mona Lisa touch and the temperature. Those are beautiful ways to restore the vaginal tissue for women who are experiencing vaginal dryness.
That's right.
And to your point about women being given choices, Sherry, I'm going to assume that it probably did not come as a great surprise to your physicians that you were going to experience vaginal dryness as an adverse event or a side effect, let's say, of the treatment that you were getting. Were you given options and informed about what you could do in the same manner that Dr. Shepard did?
I was given from my oncologist just certain creams that I could use, but it did not touch it like the Mona Lisa did. And I just really, I can't say enough about the Mona Lisa, because there's so many, like I said, there's so many ladies out there that do not even like the creams. You could talk to them about it, saying, oh, you could use the cream at night, and everything, and they'll say, oh no, it's too messy. They don't want to use any type of messy creams or anything like that. And so they were really excited to know that I did not have to use any of the creams with the Mona Lisa. So,
Dr. Shepard, it sounds like this is an opportunity for physicians to get educated as well.
I think it's a beautiful opportunity because even myself, as a gynecologist for years, I'd heard about vaginal rejuvenation, but I didn't really know the intricacies of it and really how it could help women. I think, once I turned my perspective on the patient experience and what they go through, I typically would recommend vaginal creams, hormone replacement in the form of pills. But what I did find listening to more patients is, like Sherry said, it's a lot to do every day. It's messy. And if you forget it, then, your tissue feels that lack of what you were unable to do. So there's so many different things with the upkeep of those options that if they're not given other options, then they're stuck. And, to Sherry's point, she had breast cancer 7 years ago. She's a survivor.
yes, I am.
Yes.
Is that she'd gone years without really having the therapy that she needed. And so I remember the conversation that we had because I started, at this practice, and Sherry was one of the first people that I met, and she's fabulous. We've been friends since then, and we're like joined at the hip. But I found that when we got that device into our space, it really was through conversation that she was like, hey, this could be something for me. So it wasn't this direct transaction of, Sherry, I think you need, vaginal rejuvenation with the CO2 laser. It was because I was so excited to offer this to patients that through my excitement and discussion on what it could do, Sherry was like, I think that I'm a candidate for this. And, from what you're saying, I should get this. And I was like, absolutely, you should. Let's do it. And that's really how we got to the space
there.
And you made an excellent point that escaped me previously, that you had actually dealt with your discomfort for multiple years.
I did.
Simply because of a lack of information.
Right. Exactly.
And she's not the only one. There's so many women out
So
there
many that are
menopausal, breast cancer survivors who struggle with this on a daily perspective. So again, when we talk about below the belt issues and how in the aesthetic space we can really do something for women and even for men, there are a lot of modalities that help men in the cosmetic space. But really, just because it's below the belt, I feel that a lot of women don't have the ability to share as openly as they would with maybe other parts of their body. And so when we have that ability to open the discussion and to discuss something that they can feel better about themselves, but in a safe space, then there are a lot of women who can really benefit from some of these procedures and modalities.
And I know that when we were in the practice and everything and talking to the patients, there's so, like she said, there was so many patients that did not want to open up about it to some of their doctors that we worked with. And so they would come get me and I would talk to them.
Mm-hmm.
Dr. Shepherd would come get me and I would talk to her patients about it. I talked to some of the other doctors' patients about it. And they were so excited to hear about it.
And you can see through her story, through her ability to share and use her voice, that so many other women benefited from feeling like they weren't the only one. And I believe that opens doors for women to hear stories like this, and for us to sit together and share
Yes.
from a physician perspective and from a patient perspective. That joint effort really can change lives.
What's your biggest takeaway from this conversation? And what topic are you dying for us to cover next? Comment below and be sure to like, share, and subscribe. And tell a friend. Together, we'll grow this channel and the Bianca movement. We'll see you next time here at the intersection of inner and outer beauty.